With all your permission, it's already 3. Can we start, ma'am?
Yes, Farhan.
Yes, ma'am. Good afternoon, everyone present here. I welcome all the participant doctors on today's session. Let's welcome today's speaker with great honor, Dr. Arati Nayak, ma'am. Ma'am has done MD, FICOG, FMAS, FICMCH, and Diploma in Urogynecology, and Senior Obstetrician and Gynecologist at Specialist at BMC Hospital, Bhubaneswar, Odisha. Today she is going to speak on a topic management of vaginal discharge. Let me tell you overview of the topic. Doctors frequently encounter vaginal discharge as a presenting symptoms in many different settings. Each woman has her perceptions of what is normal and what is excessive and what are unacceptable for her. On the other hand, the quality and quantity of vaginal discharge can be changed over time in cycles within the same woman. Vaginal discharge is a poor indicator for the presence of STI, and even though atypical vaginal discharge frequently causes women to cease screening for STIs. And for this, I would like to invite and hand over this session to Dr. Arati Nayak, ma'am, to discuss more about it. Over to you, ma'am. Kindly proceed from here.
Am I audible?
Yes, ma'am, you are clearly
Yeah.
audible. You can proceed with this session.
Good afternoon, all. Respected all doctors and delegates present over here. Thank you all for having me in this platform. Well, my topic is vaginal discharge and its management. So whenever a patient coming to our OPD with complaints of vaginal discharge, we are simply giving antifungal drugs or antibiotics or vaginal pessaries. These drugs will subside these symptoms for few weeks, but again after few weeks there is recurrence of symptoms. So why there is recurrence? Because we are not doing examination properly, especially post speculum examination in case of reproductive women, in perimenopausal women and postmenopausal women, and we are missing many positive findings like erosion of cervix, ectropion of cervix, or old tear, or cervical polyp. And we could take high vaginal swab also for diagnosis of this vaginal discharge. And most important thing, we can differentiate between normal vaginal discharge or physiological vaginal discharge and pathological vaginal discharge. And normal vaginal discharge and physiological vaginal discharge doesn't require any treatment, whereas pathological vaginal discharge requires treatment. And if we will treat the normal vaginal discharge or physiological discharge, it creates a further problem that I will tell subsequently. Why I selected this topic? Because this is commonest reproductive tract infection, and every fourth woman in the OPD suffer from this problem. And if we will not treat this condition, this case leads to multiple morbidities that includes recurrent UTI, dyspareunia, that is painful intercourse, chronic pelvic pain, menstrual irregularities, that is in bleeding in between menstruations, and infertility, obstetric complications like abortion, ectopic and stillbirth, and sometimes there is mortality also. I'll address this topic under this heading. First, I'll tell what is normal discharge, what is abnormal discharge, and what is role of estrogen, and what is physiological and pathological causes of this vaginal discharge, and what is the reasons in different age groups, and discussion on commonest organisms, then what is syndromic management, and what are the vaginal health tips, and how to prevent these conditions, and what are the awareness available in the present society, then what is the take-home message and references. Then what is vaginal discharge? It is a secretion from the glands of the vulva cervix, tubes, and endometrium, and transudate from the vaginal wall. Normally, the cervix has two parts. One is endocervix and ectocervix. The endocervix having endocervical glands, that is a major contribution of this vaginal discharge. And normally, transudate is produced from the vaginal wall. The vagina is supplied by the vaginal plexus, and when there is increased blood flow in some situation, like when there is pregnancy or infection or during ovulation, there is more blood flow to the vagina. So there is increased transudate formation to from the vagina, and that contributes to the vaginal discharge. And vagina is also supplied by the skinny gland that is responsible for the lubrication of this vagina. And there are some normal flora that is present in the vagina that can be aerobic or anaerobic. The aerobic flora includes lactobacilli, streptococcus, staphylococcus, Gardnerella vaginalis. And anaerobic flora includes Peptococcus, Peptostreptococcus, and Bacterias. The normal pH of the vagina is 3.8 to 4.5, and it is odorless and white or sometimes colorless also. This is the normal anatomy of female genital tract. That is, that is uterus, which opens to the fallopian tube, and then uterus is open to the cervix through the internal os. And as I have mentioned that cervix has got two parts. One is ectocervix, another thing is endocervix. The ectocervix opens to the vagina, then to the vulva. So the normal quantity of vaginal discharge is 2 to 5 ml, and when it exceeds the 2 to 5 ml, then it exits from the vagina to the vulva. Then what is the role of estrogen in the production of this vaginal discharge? During reproductive period, there is more concentration of this estrogen, and this estrogen helps the vaginal flora, mainly the lactobacilli, which is present in the vagina, that converts this estrogen causes proliferation of the vaginal epithelium, and there is accumulation of glycogen. And the estrogen causes conversion of glycogen to lactic acid by the lactobacilli. And this lactic acid converts the vaginal pH between 3.5 to 4.5. But in case of postmenopausal women and pre-pubertal ladies, due to lack of estrogen, the lactobacilli cannot convert the glycogen into lactic acid. So there is alteration of vaginal pH. And when there is alteration of vaginal pH, it is more susceptible to infection by the pathologic organism. Another thing is, whenever we are giving irrational drugs, antibiotics or antifungal agents, we are that drugs simply causes destruction of the normal healthy flora. And once the healthy flora is destroyed, then the conversion of glycogen to lactic acid is impaired, and so the lactic acid production is reduced, and there is alteration of vaginal pH. When the vaginal pH is altered, they are more susceptible to infection by the pathologic organism. So postmenopausal lady and prepubertal lady are more prone to infection by the pathologic organism due to lack of estrogen. Another thing is, whenever irrational drugs are given, they are cause destruction of the this lactobacilli, and so conversion of glycogen to lactic acid is impaired, and the production of lactic acid is reduced, and there is alteration of vaginal pH. So they are more prone to infection by the pathologic organisms. Normal vaginal discharge or physiological vaginal discharge. Physiological vaginal discharge occurs during ovulation, during pregnancy, and during premenstrual period. And whereas pathological vaginal discharge that occurs in children, that is known as vulvovaginitis, during reproductive period, that occurs due to vaginitis, due to cervicitis, and pelvic inflammatory disease. And in postmenopausal women, due to ectopic vaginitis. And the most important thing is, we have to rule out malignancy whenever a postmenopausal woman complaining of vaginal discharge. So any change in normal flora that affects quantity, color, and smell of vaginal discharge, then we'll think it is a case of pathological discharge. So vaginal discharge in children known as vulvovaginitis, the causes can be non-specific or specific. The non-specific causes are poor hygiene or allergy to some materials or due to foreign body. And that can be managed by taking toilet hygiene and avoid chemicals and avoid non-medicated creams. And the specific causes of vulvovaginitis during children are streptococcus or pinworm infection or other infections. So for pinworm infection, we can give mebendazole and antibiotics for other infections, and local estradiol cream can be used. Then vaginal discharge during reproductive period, it can be physiological or can be pathological. Physiological vaginal discharge during reproductive period occurs due to ovulation or during premenstrual period during pregnancy. And pathological discharge during reproductive period occurs due to vaginitis, cervicitis, and acute and chronic pelvic infection. Pathological discharge during reproductive period because of infective origin or non-infective origin. The non-infective origin includes because of foreign bodies like return tampons or condoms or cervical polyps and ectopic or genital tract malignancy or fistula or allergic reaction. And the infective causes can be non-sexually transmitted or sexually transmitted. The sexually transmitted infective causes includes because of chlamydia trachomatis infection or Neisseria gonorrhoeae infections or Trichomonas vaginalis or herpes simplex virus infection. The infective causes that are non-sexually transmitted causes are bacterial vaginosis or Candida albicans. So sexually transmitted mainly by Chlamydia trachomatis and Neisseria gonorrhoeae and Trichomonas vaginalis, whereas non-sexually transmitted are bacterial vaginosis and Candida albicans. Cervicitis, it is another cause of vaginal discharge during reproductive age group, and the diagnostic criteria includes there will be prival epithelium, it bleeds on touch, or sometimes there is ectropion, or there is discharge of mucopus, or the ascending of this infection cause PID. Postmenopausal women, vaginal discharge occurs due to estrogen deficiency. There will be atrophy and thinning of epithelium, and there is alteration of pH, as I was mentioned earlier. The causes of vaginal discharge during postmenopausal women are senile vaginitis, cervical carcinoma, and pyometra. In senile vaginitis, there will be purulent discharge, and she will complain of spotting or bleeding. In cervical carcinoma, there will be foul odor. She may complain of postcoital bleeding or purulent blood stain discharge. Pyometra is collection of blood inside uterine cavity. It is another cause of vaginal discharge during postmenopausal women. There will be fever, tachycardia, and blood stain discharge and enlarged tender uterus. So healthy vaginal discharge is either clear or whitish in color. It is odorless and it can leave a yellowish tint on your underwear, and it changes its consistency throughout menstrual cycle. Before ovulation, it is watery, and after ovulation, it is thick because of production of progesterone. And abnormal vaginal discharge is either yellow or green or gray in color. It resembles cottage cheese in color and consistency, and it looks foamy or frothy, and it has got strong smell like fish or yeast or another odor, and sometimes it is brown or bloodstained discharge in case of malignancy. So when to see a healthcare provider? Whenever there is itching of vulva, or there is bad odor, or there is pain during vaginal discharge, or pain during intercourse, or when there is redness, burning, soreness, or swelling of the vulvar skin, or there is genital ulceration, or abdominal pain, or pelvic pain, or perianal pain, then one should seek the help of healthcare provider. So these are the types of abnormal discharge and their possible causes. Thick white cheesy discharge occurs in case of candida infection, and the associated symptoms are swelling and pain around the vulva. There will be itching, painful sexual intercourse. White, gray, or yellow with fishy odor discharge occurs in case of bacterial vaginosis, and she will complain of itching or burning or redness and swelling of the vagina or vulva. Cloudy or yellow color discharge occurs in case of gonorrhea, and she will complain of bleeding in between cycles, and sometimes there will be urinary incontinence. Frothy or yellow or greenish discharge occurs with bad smell that occurs in case of trichomoniasis, and she will complain of pain and itching while urination. Commonest organisms responsible for vaginitis are bacterial vaginosis, Trichomonas vaginalis, or Candida albicans. And cervicitis, the organisms are Chlamydia trachomatis, Neisseria gonorrhea. And pelvic inflammatory disease that can be acute or chronic. The acute pelvic inflammatory disease, the organisms are same as of cervicitis, that is Chlamydia trachomatis and Neisseria gonorrhea. And chronic pelvic inflammatory disease caused by tuberculosis. Candidiasis is the most common organism responsible for vaginal discharge, and in 80 to 90% case, Candida albicans is detected. Other organisms responsible for these infections are Candida glabrata, Candida tropicalis, Candida krusei. And it can cause acute or recurrent or severe type of candidiasis. The predisposing factors for Candida infections are when there is use of antibiotics, or when there is uncontrolled diabetes mellitus, or in presence of HIV, when the immunity is reduced, or during pregnancy due to increased vaginal acidity and increased glycogen content, they are more susceptible to infection by the Candida. And use of oral contraceptive pills or tight undergarments, and use of deodorants, vaginal contraception also susceptible for development of infection by the Candida albicans. Acute vulvovaginal candidiasis, there will be cloudy white discharge, and she will complain of intense pruritus, dysuria, and erythema, excoriations. And on microscopy, there will be presence of pseudohyphae. Culture no longer recommended. The treatment is fluconazole 150 milligram. We can give weekly for 6 weeks or 8 weeks. Clotrimazole pessary can be given. Clotrimazole cream 10% also available. Miconazole also can be used. Recurrent vulvovaginal vaginitis, candidiasis, when there is 4 episodes of this candidiasis in 12 months, and with 2 episodes confirmed by microscopy or culture, then we can tell this is a case of recurrent vulvovaginal candidiasis. When there is 4 episodes in 12 months with 2 episodes confirmed by microscopy or culture. And the causes of recurrent vulvovaginal candidiasis are when there is poor control of diabetes or immunosuppression, or when there is deficiency of iron, zinc, magnesium, and calcium, and use of irrational antibiotics and antifungal drugs that destroy the healthy vaginal flora. Then bacterial vaginosis, it occurs due to change in the normal microbiome of vagina, when there is overgrowth of facultative anaerobic organism, that is Gardnerella vaginalis or Bacteroid species. And she will complain of gray homogeneous discharge and fishy odor, and there is no signs of inflammation or erythema. And the diagnostic criteria is known as Nugent's criteria or EMCEL criteria. We'll get clue cells. We can do PCR test and DNA probe test. The treatment is metronidazole 400 milligram twice daily for 7 days, or single dose of metronidazole, that is 2 gram. Intravaginal metrozil or clindamycin can be used. Tinidazole single dose 2 gram can be also used, and oral preparation of clindamycin, that is 300 milligram twice daily for 7 days, is a good alternative to metronidazole in case of bacterial vaginosis infection. Then Trichomonas vaginalis, it is caused by a flagellated protozoa. There will be yellow to green color discharge. She will complain of intense pruritus, irritation, and dysuria. And there will be strawberry vagina and cervix and vaginal erythema. Diagnosis is by wet mount test or NAT test. The treatment is metronidazole 400 milligram twice daily for 7 days, or single dose of 2 gram, also good alternative. Chlamydia is caused by Chlamydia trachomatis. It is a obligate intracellular bacterium. There will be mucopurulent discharge, and she will complain of dysuria, lower abdominal pain, and deep dyspareunia, and postcoital bleeding, sometimes intermenstrual bleeding also there. And the complication includes, there will be PID, and this chlamydia disrupt the tubal endothelium, and that causes tubal infertility and sometimes ectopic pregnancy. And diagnosis is by gram stain and by culture, by NAT test and DNA probe test. And for treatment, we can give azithral 1 gram or doxycycline 100 milligram twice daily after food for 7 days. Gonococcal infection, it is caused by Neisseria gonorrhoeae. It is a gram-negative diplococcus. There will be mucopurulent discharge. It is spread by direct inoculation. It is a sexually transmitted disease. She will complain of dysuria, abnormal uterine bleeding, and diagnosis is by gram stain, culture, NAT test or DNA probe test. And the treatment is single dose of cefixime 400 milligram is a better option. Then what is syndromic management? When group of common symptoms and signs caused by more than one organism, then we can tell it is a syndromic management. Then what are vaginal health or hygienic tips? Wash vagina with mild soap and warm water. No douches, no scented soaps or sprays or powder. Wash after coitus, and adopt safe sexual practices, and don't shave your pubic hair, because pubic hair provides protection to the internal genitalia. And use cotton underpants, no panty liners, no tight fitting clothes. Sanitary pads should be changed every 4 to 6 hours during cycles. No self-medication, and don't ignore signs of vaginal infection. Whenever there is itching or swelling or there is excoriation, just consult the gynecologist. Then how to prevent? We have to improve the literacy rate. We have to improve the economic status of the patient, and women empowerment and medical education programs and health policies. We can prevent this vaginal discharge. Then take home message is, it is a commonest reproductive tract infection. It occurs because of change in normal flora that causes vaginitis. One should take proper hygienic measures and adopt safe sexual practices, and don't ignore if abnormal vaginal discharge or associated with other symptoms, and improve literacy, economic and awareness programs. And finally, I want to tell, whenever a patient comes to you with complaints of vaginal discharge, don't forget to do post-speculum examination. By post-speculum examination, we can detect many lesions of the cervix, mainly erosion of the cervix, cervical polyps, and old cervical tear and ectropion. And we can take high vaginal swab also, and we can differentiate between normal vaginal discharge or physiological discharge or pathological vaginal discharge, and don't treat physiological discharge or normal vaginal discharge, because by treating this normal vaginal discharge or physiological vaginal discharge, these drugs destroy the healthy vaginal flora, and by destruction of this healthy vaginal flora, the production of lactic acid from glycogen is impaired, and there is alteration of the vaginal pH, and that leads to more infection by the pathologic organism. So thank you. Thank you, Farah.
Yes, ma'am. Thank you so much, ma'am, for giving your valuable time and sharing your knowledge with us and making this session informative one, ma'am. I definitely think this session knowledge is going to help all the viewers who have joined this session, ma'am. We have received some question, ma'am. With all your permission, can we take this question, if you allow?
Yes, yes.
Yes, ma'am. I can see, ma'am. The question is that first question is, what is the role of saline wet mount test in workup of vaginitis?
We can detect the pathologic organism saline wet mouth test.
Okay, ma'am. Thank you so much for answering, ma'am. Proceeding forward, I can see there is a couple of questions. The question is, which medication in the drugs class antifungals are used in the treatment of vaginitis?
Can you repeat it?
The question is, which medication in the drug class antifungal are used in the treatment of vaginitis?
Fluconazole or itraconazole we are using oral drugs, and miconazole, clotrimazole for vaginal drugs. They are used as antifungal agent for local vaginal pessaries.
Okay, ma'am. Thank you so much for answering. The one last question is that which dietary and activity modification are used in the treatment of this disease?
Sorry.
The question
Please.
is, ma'am, which dietary and activity modification are used in the treatment of this disease?
Yeah, healthy diets, balanced diet, and healthy activities, and healthy tips that I've already mentioned. They are necessary to prevent this vaginal discharge.
Okay, ma'am. Thank you so much, ma'am. I hope that all the answers are clear to all the questions we have asked this, ma'am. As of now, we don't have any question, ma'am. With all your permission, shall we conclude this session, ma'am?
Yes.
Yeah, ma'am. Thank you so much once again, ma'am. Hope to see you again with a different topic. Till then, take care of yourself.